is manual dexterity? Manual dexterity is the ability to use your hands in a skillful, coordinated way to grasp and manipulate objects and demonstrate small, precise movements. Do you notice that you have difficulty grasping a pen, your toothbrush, flossing, putting on makeup, shaving, fastening clothes, and tying shoelaces? Manual dexterity is essentially the ability to do all of the aforementioned activities. Poor or lack of manual dexterity results in poor two-handed tasks, causing problems with using cutlery, cleaning, cooking, craft work, playing musical instruments, and, well, your oral hygiene. Lack of manual dexterity can affect your ability to maintain optimal oral hygiene if no modifications are made to things like toothbrushes and other oral hygiene aids for grasping and use.
Toothbrush adaptations make it easier for patients with poor dexterity to brush their teeth. The first thing that we have is a rubber band, which can be added to a regular toothbrush to attach it to a patient's hand. There are also toothbrushes with special handles that are designed to hook onto the patient's hand. These are good for patients that have weak grip strength because it adds stability while they brush their teeth. Another thing that you can do to make brushing easier is add bulk to a toothbrush handle. This makes it easier for the patient to grip. There are specially designed toothbrushes that you can buy at the store that already have bulky handles, or you can do it yourself at home. One way that you can do it at home is by wrapping a towel around the handle to make it more bulky. You can also use putty and wrap that around the handle, and this is a good option because it molds to the patient's fingers, which makes it even more stable. The last thing that you can do is use a tennis ball and attach that to the end of the toothbrush.
Brushes have many benefits. Compared to manual toothbrushes, electric ones have different parts to them. For example, Oral-B electric toothbrushes come with 4 different modes like deep cleaning, whitening, sensitivity, and tongue cleaning. It also comes with a 2-minute timer on it so you know you are brushing for the full amount of time you need to. Electric toothbrushes come with pressure sensors which will notify you if you are brushing with too much pressure, and they also have rotation oscillation which will remove 100% more plaque along the gum lines. Electric toothbrushes are beneficial to anyone with manual dexterity limitations. This includes people with arthritis, muscle dystrophy, or even someone who is just of older age. They are even beneficial for children and to ensure they are brushing their teeth better. Some popular toothbrush brands are Sonicare, Oral-B, and Burst. Different electric toothbrush brands offer different features, so it is important to do your research to see which brand will work best for you. Electric toothbrush prices can range up to $200. It can be a large investment, but it is worth it because
Common methods of flossing is called the spool method. This one is recommended for individuals who don't have issues with stiff joints or fingers. To use this one, cut about 18 inches of floss and move your fingers with your index and your thumb and maneuver the floss up and down several times, forming a C shape. Also, it is recommended to move below the gum line, as this is where bacteria is known to collect heavily. The second method for flossing is called the loop method. This one is effective for children and individuals who have issues with dexterity, such as arthritis. To do this one, you have to tie a knot in one of the ends. Do about 2 to 3 knots. You have a circle, and then you're going to secure it and use all of your fingers except your thumb and guide it around. And then the same as the spool method, do a C shape and go below the gum line. And move it around so you can floss with a different area. And this is called the loop method.
Using a water pick once a day, in addition to regular brushing and flossing, is an effective way to flush out hidden debris and bacteria from hard-to-reach areas around the teeth and gums. As we age, we become less dexterous and have a tougher time accessing hard-to-reach areas. A water pick can help reach those areas that may be missed. A water pick works by shooting a pulsating stream of water to dislodge and remove debris. It helps remove food particles and plaque that can harden and cause more serious periodontal problems. To use a water pick, fill the reservoir with warm water. Some people may choose to add a few drops of hydrogen peroxide or a small amount of mouthwash to the warm water. Bend over the sink and allow the water to flow out of your mouth, or just close your lips and spit out as needed. Starting from the back teeth, move forward towards the front. Run it around the gum line of every tooth. Aim and shoot into all the areas where food traps and plaque can form. Once you're done with the top, move to the bottom teeth. Again, from back to front, covering every tooth. Do this once a day as part of your dental hygiene routine for better periodontal health.
What is a proxy brush? It is an interdental cleaner, which means it cleans areas in between teeth. It is important to maintain these areas clean to avoid plaque accumulation, since a toothbrush is not able to access these sites and remove the plaque. Floss is the most common interdental cleaner, but it may be difficult to use on people with braces or those who lack manual dexterity. Number 1 shows healthy gingiva that contours nicely with the teeth. The knife-edge interdental papilla fills in the interdental spaces. Since there is no space in between the teeth, an interdental brush should not be used. Number 2 shows the gingiva losing its contour. The interdental papillas are flat and rounded, creating spaces. A small interdental brush can be used to remove any plaque in between. Number 3 shows recession and the roots have become exposed. These spaces between the teeth have enlarged. A bigger interdental brush can be used. It is important to use an interdental brush that fits into the space. Forcing a brush can cause trauma to the tissues.